it's Dr. Brooks. Welcome to Healthy Kids Corner. This week we're going to talk about growing pains, and this is really a common thing that I believe is maybe miseducated out there to parents, or they don't know what to do if their kid's complaining. So just a brief overview and maybe a little bit of education so you know what to do if your child is complaining. Growing pains in children are not as common as many of you may think. Growing should not really cause pain, nor is pain really common in children. So many children are active, and these activities get them out of alignment. A gentle chiropractic adjustment can relieve this and their discomfort. So I brought my little model, Mr. Bones, with us today to kind of talk about the alignment of the spine and what can be done. So chiropractic is based on the important relationship between the spine and the nervous system. So one of the most basic ideas in chiropractic is that dysfunction in the spine and its joints can lead to dysfunction in the nervous system. When you have that nervous system get a little upset because it controls and coordinates all the systems of the body, the spinal dysfunction, also called a subluxation, can have a wide-ranging effect on the body's health. So as a chiropractor, I've been caring for children exclusively for, I guess, close to 8 years, and chiropractors have been treating children for more than 100 years. So I am a pediatric chiropractor. I just have a special certification in pediatrics. So what I've done over the years is when parents come in complaining that their kid is having, knee pain, foot pain, back pain, anything like that, and they call in and say, I think it's growing pains. It really isn't growing pains. A lot of times there's just in the spine, we go ahead and we palpate and feel for misalignments, and we correct those misalignments very gently. Even in small infants and small children, it's done with our thumbs, and in larger children, it can be done very gently as well. So this is not something that's painful. My kids that do have pain or complain about discomfort often feel amazing before they even leave the office, and they will then be able to communicate with the parent, hey, something isn't right, I need to go see Dr. Brooks. So it's really something that if your child is complaining about pain, the chiropractor would be my first stop. In the case of growing pains, I often find misalignments in the children's spine, legs, feet, and shoulders, which is really creating an aching or a throbbing pain that they feel and that they are complaining of. So when those misalignments or subluxations are found, a gentle adjustment can help correct it. I always explain to parents that muscles are attached to all the bones, so muscle pulls bones, and sometimes what they're actually feeling is muscular discomfort due to the misalignment. Also, your chiropractor may order an x-ray to find out any kind of abnormalities that may be going on, such as scoliosis or bone spurs or different things like that that could also be creating pain. So just something to be aware of, but that's why it's typically so easy to fix children that are complaining of pain. So that's a little bit about why and how it's so easy to fix children that have misalignments that are complaining about achiness or pain. Let me tell you a little difference between the chiropractor and maybe somebody like myself that specializes in pediatrics. So all of us are taught how to adjust the spine of any age person. So if you're nervous about going to a chiropractor for your little one and you'd rather just see a pediatric chiropractor, you can search one out at icpaforkids.com, and you can do a zip code by search. And really, this training just makes it possible for myself and others that are pediatric chiropractors to really understand and evaluate the spinal misalignments and musculoskeletal systems in children specifically. So again, spinal adjustments for infants and young children involve really light fingertip pressure to correct any of those misalignments. So not anything that's painful, and there is a lot of research to back up chiropractic care for children. You can see more of that on our website at mychildwellness.com, and any of the tabs under chiropractic will have research studies to go along with them. So again, hopefully that's helped just to give you a little bit of education about growing pains, that they're not common and that they're not normal, and you really need to seek out care with a chiropractor. If you'd like to find out more information about other topics, we do webinars once a month, or I do them once a month, and you can see those or attend those for free. I also do clinician webinars, so if there's any docs that are watching, you're more than welcome to attend those as well. You can find both courses of our monthly webinars on the dramberbrooks.com website under education. Also, we're on Facebook at Whole Child Wellness, so click and like us there, and you can share that information with family and friends as well as get some education yourself. We are on Twitter at wholechild4u, and also, as you know, on YouTube at Whole Child Wellness. So if you'd like to read more about our practice, it is at mychildwellness.com. And again, we go into a lot of specifics on children on our website, so if you really want to get some more information, please see that there. If you're in the area, we'd love to see you as a patient. If not, you can visit that website at icpaforkids.com and find a pediatric chiropractor in your area. Have a great day and see you next week. Bye.